The effects of ADD and ADHD on adults?
Well, adults,
It has to be a little different than kids, because adults have to conform more and fit in better.
they do, and they have strategies usually. Either that, or they just kind of they're on the fringe of society, right? I mean, there are plenty of people like that. But if adults can have a strength that they can draw on, they can sometimes have strategies to kind of get around it. For example, a lot of times people will choose a career that is that they're more able to do. Usually it's a career that can be is fairly exciting or something like that. They're not going, they're not going to be they might be in the emergency room instead of being a pathologist or something, if they're going to be a doctor.
Right, so
they're going to be
more,
something that's really pretty exciting that will keep them high.
Keep their attention.
Yes. So that happens. But maybe they're okay with their job, or maybe not. Maybe sometimes people really do have trouble keeping jobs because they can't stay interested in what they're doing. They keep switching, or it's always there. Or they have a difficulty with being impulsive, and so they make bad decisions, or they insult the boss or something like that because they're not careful about that.
About their words.
Right. And so there's a whole range of, different things that can be affected by ADD. Also, certainly their interpersonal relationships, with their family, that can be very strained because they might be disorganized. They might be, a lot of times I've seen people who, they do okay as long as there's not too much on their plate, but then they get too much and they can't handle it, and then they get irritable, and the kids, feel it, and then the kids react to that, and it's
catch-22.
Yeah, sad.
Wow. But so the neurofeedback helps with all of that. Now, when you work with ADD, if somebody is lightly ADD, if you can call it that, or generically ADD, then they would work with you how long to start to see results?
Well,
Is there a lot of gratification in the time frame?
yes, usually a child that is just ADD, okay, will normally average about 40 sessions, which is about 5 to 6 months' time.
Okay.
And they'll really benefit. We'll see results within the first 5 to 10 sessions.
Okay.
It'll be minimal, little results, but we keep building on that and building on that. And with children, because they learn so rapidly, it tends to really become a part of them easily.
Do you work with OCD as well?
Oh, yes.
You do?
Yeah.
Okay.
A lot of children with attention deficit have these OCD or maybe
bipolar?
We have children who are bipolar. Work with that.
So what about like even adults who have like addictive behaviors? Would it help with that, the neurofeedback?
Yes, and actually, of course, that's a complicated thing, and there are a lot of programs out there that are needed to help them work on those sort of issues around, But apparently, what we know is that it helps with kind of the craving and keeps that down, and it can help with the program. And
How
it can
about
help.
smoking? Would neurofeedback help with smoking?
Have you had that experience?
I haven't had experience with that, so I don't know.
That'd be interesting to work on too. Because look at so most addictive habit, people can never stop smoking. I mean, rarely. You know what I'm saying? It's like they stop, they start, they stop, they start.
Right.
It'd be interesting. And what area of the brain does smoking affect? I wonder.
Not sure.
I'm sure it affects the whole brain.
Well, sure, the whole body.
The whole body.
But what area of the brain is for satiety? Like where you feel satiated after like either drinking or...
People respond differently to you know,
Stimuli.
to stimulants and so on. Some people can't drink at all, you know, they'll fall asleep right away. Some people can drink and drink and drink, you know, and so on. The same thing occurs, I guess, with smoking. Some people can stop it themselves, but I'm not too sure I know particularly an area that is affected, you know, that we would be
It'd be cool
dealing
to find out, wouldn't it? To see if like you see more disturbances in different areas of the brain.
They tried to work with people who, you know, obese people, what causes overeating, and as of this time, I don't think I know if they've pinpointed it yet. So
there have been some people doing what we call QEEGs, quantitative EEGs, where they use 20 electrodes and they get a more precise map
picture.
of complete picture. And there, some of the people have been showing different patterns for like, for example, alcoholics. Some alcoholics have one type of pattern where they have a lot of really fast waves, and other other people show a different pattern. It makes kind of sense because some people drink to calm down, some to
speed up,
or to be more uninhibited and things like that. So,
interesting.
Yeah.
Huh? Can you do 20 electrodes on people?
We're not doing the Qs in our office, but we do have some colleagues who do it, and we usually refer them.
Okay, tell me about the effects of autism on children and families and how you can help them. What have you done so far?
Yeah.
Share. Share. Okay, because this is exciting.
Well, autism is usually a child is, as we said, is very hypersensitive. Sometimes they just can't take loud noises. They can't take stimulating situations. That, you know, they go nutsy, you know, and so basically, you know, what it does to the family is that it's, you know,
it's
very
extremely stressful for families.
Yeah.
One of the things I would think you should share is, you know, for example, some of our kids who are starting to babble and stuff when they're not talking, becoming more playful, having better eye contact, just being more communicative, more sort of observing the environment a lot more. We have a 10-year-old child who was exposed to alcohol prenatally, and he was very really severe in a lot of ways, that he couldn't really observe what was going on around him very well. And now we've enjoyed him so much because he comes up with questions that are very insightful that we didn't expect at all from him, and it's really, for us, it's such a pleasure to see this change in these kids.
Yes. Isn't that wonderful? And how many sessions did it take before you started to see some of those changes?
Well, when we start to see changes, we start to see changes probably in 10 sessions. But you know, over, I think he's been with us about 6 months or so.
Yeah.
Twice a week, mostly.
Did you get attached to these kids?
Very much so.
Yeah, I imagine.
Yeah, and the families too. And I think they feel really comfortable. They've mentioned a lot to us about how comfortable they feel in our office. And this is such a different feeling than the other offices we've been to and things like that. So it really makes us feel good.
Good.
We like to help them, you know, in lots of ways. We do a lot of consultation in terms of, you know, advice about how to handle certain things, or refer them to other types of treatments if we think that might be helpful, if we can.
Well, with autism, does the therapy wear off, or does it just get them to a certain level and then they stay there and then they would come back later and do it again? Kind of like peeling the onion away.
Well, it can. I mean, I have one child who's 4 years old, and his mom has been bringing him for a while, and he comes does maybe 2 months of sessions, and then she stops for a while, and then
Okay.
she brings him back again. So
Is that due
that's
to costs, or
because of what?
does that have to do with the cost of the sessions?
No, she works a very difficult job situation, and she just gets worn
Crazed.
out.
And she's
busy.
coming from a long distance, too.
Yeah, so.
Okay.
Right.
So the drive is hard.
Yeah, so she does that. Other parents just keep coming and coming, which is wonderful because, you know, they want to see their child succeed and do something, you know, be more successful. And
Isn't that wonderful?
well,
Parents
it's just so
love.
gratifying to see the changes that the children are being able to make, and you know, how that hopefully they're going to be so much more successful, you know, in their lives.
No, I know people are going to wonder real quick. Go ahead. I'm sorry.
Oh, I was just thinking about that child and how actually he was starting to talk and babble and sing and do things that
He hadn't
didn't.
done.
And then I think the doctor wanted to try an anti-seizure medication, and he started stopping all that.
Oh, yeah, shutting him down.
Yeah, and so actually she just talking and
That's great.
all of that. So
That's great.
He was in the office last weekend and was counting up to
Aw,
6.
How old is he?
4.
Isn't that fantastic? Wow. Just amazing. Because autism, I know, has reared its ugly head in this country. It's grown by in leaps and bounds over the
Right.
last decade. I don't recall what the percentages are, but I know it's huge.
Right.
Do you know? I don't remember.
Don't know.
Um,
It's just major all of a sudden.
Yeah, it's like
Everybody's
an epidemic. Purport. Back. What's the ballpark cost for someone like that, for a process like this, per session?
oh, per session.
Mm-hmm.
Well, we started about at currently $80 a session. We do have some like a package that we so we charge
So
a little
people
bit
can
less.
get it down. And does insurance reimburse this?
Sometimes it does.
we try to.
If they come with a prescription from a doc, would it?
Well, we don't. We usually try to work with the parent, and we don't always need a prescription from the doctor.
Oh, no, no, I'm just saying if someone went to their doctor and received a prescription for the therapy for their child, would insurance then reimburse?
Not always.
Not always, okay. We've run out of time again. Oh my gosh. I cannot thank you enough,
Okay.
Ann and Marty. Thank you, thank you, thank you for being here. And to know that there's help for parents and children with ADD and ADHD, as well as autistic kids and people who are just having trouble dealing with their lives, you know, going through too much stress or depression, is just a huge gift. So my hat's off to both of you. Namaste. Thank you for being here tonight.
Thank
and if you'd
you.
like more information about the Discovery Center and Ann and Marty's work and their good work with you and children, please give me a call. I'm Deborah Arneson, thanking you for joining us tonight. Until next week, take good care of your health and God bless. Good night.
Well.
That was fantastic.